so if you'll allow me, I'm Dr. Colette Barrow Adams, as the lovely Brenda has shared. I'm Executive Director of Community and Population Health at University Hospital right in Newark. And so we're going to have a conversation really about something we call social determinants of health. You've learned so much on today. Can I ask you a question? And remember, I want some participation. I need some participation. Can I have some volunteers, one from each of the table in the back? Can you tell me a factor that affects a person's health outside of genetics? So don't include genetics. Don't include your personal, right, your personal choices. But tell me some factors that would impact your health negatively. In the back, what did you say? Stress. Lack of sleep. Y'all tired, huh? Lack of sleep, stress, anxiety. What about anything you learned today? No, what about, does anything are any of the subjects that you learned about today, could any of them apply when we talk about affecting your health negatively? Healthcare, debt, being broke. I love it. Any more? Someone in the back, the lady, you raising your hand? And so thank you for those who participated. Really, that was an example of something called social determinants of health. These are the factors that impact our health, right? And so it matters where you live, right? It matters where you go to school. All these things impact us. And so, listen to this, and I'm going to share this, and then I'm going to really allow the panel to introduce themselves, and they're going to talk about their work. The Center for Health Analytics Research Transformation at the New Jersey Hospital Association, they did a demographic analysis of 35 communities in New Jersey. They looked at, by community, they looked at 35 different zip codes. And so these were the neighborhoods that they said had the worst health outcomes, right? So 35 had the worst, 35 had the best health outcomes, and 35 had the worst health outcomes. The ones that had the best outcomes had an average of 80%, their population was 80% white. The communities that had the worst health outcomes, right, their neighborhoods was the opposite. They were people of color, they were black and brown. Listen to this, the top 5 zip codes, these are the ones that had the best health outcomes. They were one zip code in Trenton, Short Hills, anybody been to Short Hills? Princeton, anyone's been to Princeton? Fairhaven, and Tenafly. I only know about Tenafly because that's where I got married. That's my only association. Now, on the other hand, the 5 worst zip codes were Trenton, another zip code, Camden, Newark. We've all been in Newark, we're here right now, Newtonville, and another zip code in Camden. And so social determinants of health include the conditions in which we're born, live, grow, work, age. And so today we don't want to just acknowledge that these things exist. But to my left are these wonderful colleagues of mine. And so what I'm going to do, we planned all of these questions. We were going to give you all of this content, but we're pressed for time. And so we're going to condense it really, really short. And what I'm going to do is ask each person to introduce themselves. And as they introduce themselves, not only are they going to tell you about what they do, but they're also going to tell you what brings them to this work and what makes them passionate about working on issues that impact communities, black communities, adversely in the state of New Jersey. And so before I do that, because one of us, we were talking about what are we going to say up here, I got to ask you a question because the group in the green, y'all just having a good time. I'm going to ask you a question. Give me 5 health careers. 5 health careers. Name one. Neurosurgeon. All right, outside of doctors, come on, we got doctors, that's one. Give me another one. And so, let me introduce, my colleagues will introduce themselves, and not only will you hear about why they're passionate about this work, but we're also exposing you to other aspects of healthcare. We have one physician, we're not gonna minimize you, but we're exposing you to other aspects of healthcare as well.
Good afternoon, and thank you for having me, and thank you, Dr. Barrow. Young people, ladies and gentlemen in the green and in the black, we really stayed because of you. So we need your undivided attention because we have some stuff to share with you this afternoon. Okay? We're good? All right. So Dr. Barrow just asked about 5 jobs in healthcare, and every job you mentioned was actually a doctor, but a specialist doctor in some form or fashion. But healthcare is wider than that. And I'll start with that because my name is Valencia Maponia. I am the manager for the mobile health program here at University Hospital, not here, but at University Hospital. Prior to coming to University Hospital, I was with the New Jersey Department of Health, and I was the program manager for the COVID response team. You remember that blue bus that kept going around the state? That was my program. Prior to that, I worked in Jamaica, for the government of Jamaica, in healthcare administration for 15 years. But why am I saying all this? I'm saying this because I didn't start out as a doctor, nor a nurse, which most people know of, but I started out in community health. I'm a health educator by training, but guess what? Health is a business. So I did my master's in business, and I've married those 2 areas to become a manager in healthcare. There's so many things you can do in healthcare, and I know my other panelists would like to introduce themselves, so I'll pause there. But just wanted to say thank you for having us, and we look forward for some of you to join healthcare at some point in the future.
Hi, good afternoon. I'm Dr. Navneet Sahu. I'm an emergency and family medicine doctor over at University Hospital here in Newark, and I've been practicing for several years with patients that have a lot of barriers to their social drivers of health. 2 things I want to just leave with you today, because I'll be short. One is that having awareness over the social drivers of health is probably the one thing that you should take away today. We talked about economic stability. We talked about education. We talked about the community context. The second thing I want you to take away is I'm going to talk about the health system. One of the main ways that folks can access care in the health system is by having insurance. You may know that people's Medicaid is lapsed, right? That it requires renewal this year for the first time since COVID. So I think for you, as good citizens, talk to your neighbors, talk to your friends, talk to your family. Did you renew your Medicaid health insurance? And I think that's one thing that you can take away home today that can lead you on this path to awareness and advocacy.
Good afternoon, everybody. My name is Reverend Melvin Wilson. I'm the pastor of St. Matthew AME Church in Orange, New Jersey. I come at this a little differently. Our church is very involved in health and wellness. We have a health and wellness ministry. And the bottom line, young people, is this. If you're not healthy, you can't go to church. If you're not healthy, you can't work. If you're not healthy, you can't go to school. If you're not healthy, you can't do anything. So our church has been very involved in and concerned about healthcare outcomes. You wouldn't know this probably, but our church was the first faith-based institution in the state of New Jersey, thanks to Reverend Green and others. When COVID first came out, our church was the first faith-based institution in the state to provide COVID testing. We were one of the 10 FEMA sites throughout the state to provide COVID vaccines. When COVID came out, we had people standing in line for 3 and 4 hours to get a COVID shot, and we did over 15,000 COVID shots during that time. But the bottom line is the church as an institution in the community has to be a place where people get exposed to the information that they may not get in other places. So there has to be a partnership between the church, faith-based institutions, nonprofits, and government for healthcare outcomes to be improved.
Good afternoon. I'm Deanna Minus Vincent. First and foremost, I am a mother, I'm a wife, I am a daughter, I am a native Trentonian, and you heard that Trenton, like Newark, has some of the worst health outcomes and life expectancies in the state. Where I grew up in Trenton, the life expectancy is 68, and right down the street, 9 miles in Princeton, life expectancy is 82. And I tell you this because it has to do with why I do this work. So I've been in this work for quite some time. Early in my career, I worked in maternal child health planning, black infant mortality, where I lost my first baby, my husband and I, but I always say that wasn't the one that was for me. I have the one that's for me. And she just turned 22 years old, and I'm so happy about that. I then oversaw housing for the state of New Jersey. I most recently worked at RWJ Barnabas Health, where I oversaw the Social Determinants of Health and made sure that every patient who came through our doors was asked what kind of food they eat, what kind of housing they had. Because what we understand is that if a diabetic patient comes through our doors and we only give them a prescription that says take with food, and we don't also ask them, is there a grocery store in your neighborhood? Do you know how to prepare healthy foods? Can you get to the doctors? Then we're not doing our jobs. And if your doctor doesn't ask you that, then find a new doctor. Most recently, after 2022, when I had a heart attack and I lost my mom, I decided that the stress, someone said that stress was a factor. I decided that I didn't want to do that anymore. I decided to start my own firm. And now I work with my partner, Tracy Parrish Benjamin, in the Outcomes Architect, where we provide executive consulting for healthcare entities and companies across the United States to really address systemic racism and other issues and make sure that people are addressing social determinants for their employees.
So good afternoon, everyone. As Deanna Minus Vincent said, my name is Tracy Parrish Benjamin. I'm a social worker by training, but I think the most important thing to acknowledge is that I'm also a disruptor. And I think a lot of times individuals think about the healthcare system and limit it to physicians or limit it to the hospital. And I think it is so important that we reimagine health. Health is in your school, health is in your barbershop, health is at your hairdresser. And it's important for you as young people to make sure that you have a voice, that you showcase that being a disruptor means asking your teacher, why are there practices that are happening in school that don't focus on my health? And I say that to say because if you rely only upon your doctor or your nurse to be responsible for your health, you're very limited in your scope. So just to give you a quick background of my, my background and where I'm from, I'm originally from Brooklyn, New York. It took me a very long, thank you for the hand clap. It took me a very long time to acknowledge that I was a New Jerseyan. I've been here now for 12 years, and I'm finally saying I'm a New Jerseyan. Yes, I know. Thank you, thank you. It's been hard. But I say that to say that my background is that of Caribbean American, and I grew up in a household where it was so important to speak well, right, in order for you to be seen. And that was really good for me in my upbringing, but what it caused was a lot of inferiority complexes when I entered rooms where I was the only. So I spent the majority of my career being in rooms, whether it was working with a nonprofit, working in a hospital, or working most recently within health insurance, and being the only. So being the only woman of color, being the only black woman who has natural hair. And I found myself constantly saying, oh my goodness, why am I the only? Why am I the only? And I realized it was important for me to take a step back and acknowledge the importance of being a disruptor, not focusing on why am I the only, but turning that into a positive and saying, you know what, I'm here for a reason. So that's my message to young people that are out there. I still consider myself young, so I'm a part of that, but you're a little younger. My thought is, how can you be a disruptor, but how can you continue to make sure that you advocate for health? That you recognize health is your ability to go out and have a good time. There are people who are not able to do that. So if you have that, you want to make sure that your communities are fostering the same kind of attitude. So I thank you for your time.
Hi, everyone. My name is Kim Birdsall. I'm so honored and humbled to be on this dais with these amazing professionals who are dedicated and really are change makers. And I think that the message for all of the youth here is you're change makers as well. So I come from a background of public health. I spent a lot of time doing emergency preparedness and planning. Really evolved through, after 9/11, I felt called to that. I was called to public health, grew up during the HIV/AIDS crisis, felt that it was really important for us to get involved, to understand how we can empower one another and build communities that create health. One of the things I often say from a public health background is many times we fall into this health education component, and that's really important. We need to understand how we can be healthier, but we also need to drive to create communities that allow us to be healthier, right? Addressing those social determinants of health. How do we make sure that communities are safe, that there's access to healthy food, that educational systems are strong, that there's job opportunities? And what I would say, and really builds upon the Reverend, is in regard to that your health is critical. We learned that during COVID. And communities have so much power, community-based organizations that work with individuals and understand the needs. The voice that you all have, the voice that they have, continuing to elevate that and challenge the systems, both the healthcare system, the structural systems within communities. That's how we're going to really advance health equity. I come to this work because I truly believe that we all need to live in a community that everyone is treated with dignity and respect, and that there is equity, and everyone has that chance to live the healthiest life possible. So I hope that answered the question. Sorry if I rambled, but I really am honored to be here with you. And I challenge you, the youth there, who are maybe half listening, use your voice. You're the future generation. You're on the cusp of something amazing, and so is the healthcare system. There's really some amazing change happening that we're even having this conversation here today. So the baton's going to get passed to you.
Thank you for that. And truly, yes, we pass the baton to each and every one of you to really be concerned about the health of your communities and your own health. Everything that we've talked about today, looking at finances, looking at disparities in all areas, and education, all of these things impact a person's health. I'll close with this story, because I said this is the truncated version. I'll close with this story. Not too long ago, I was driving from Maplewood, going to my eye doctor, and then headed to work. I work in Newark, and I'm aware of this every single day, but on this particular day, I think it was maybe my senses were just awakened, maybe I was more attentive, but it was a beautiful day, and I was driving through, and I wish I remember the name of the street. It's a gorgeous street that connects Maplewood to South Orange. It goes through and it ends up on South Orange Avenue. Gorgeous. What's the name of the street? Valley Street. right? And so on both sides, there were these mansion properties. And I remember driving through and like, wow, this is beautiful, it's immaculate. I couldn't remember if I had been down that specific block, right? I just couldn't remember. And then I made my right onto South Orange Avenue, and just within a mile, right, there was a drastic change in the neighborhood. All of us, we live through this every day. Every single one of us, we see this in our coming and our going. But on that particular day, as I stated, I don't know why, but I was, maybe that day I was more conscious. Maybe that day I was more awakened to my surroundings. And I began to think about the opportunities of those who were in the households of Valley Street. And then when I went on South Orange Avenue, I began to think about the lack of opportunities for those who were in South Orange and further down into, the West Ward, right, into the Central Ward of Newark. And I began thinking about the drastic differences in life between the two. How one just simply has to go through Newark because that's the route that takes them to their home, while the other one, this is where they live, this is where they make their residence. And already, right, we look at the opportunities that are available have already started out young people. You take one person that grew up on Valley Street who's 2 years old, you take them today, and then you go down to Grove Street on South Orange Avenue, and you take that same 2-year-old, just a simple 1 to 2 mile difference, but yet their life chances are drastically different. This is the work that we engage in every single day. How can we, from the health sector, play a part in making sure that everyone that encounters us, whether it's in our hospitals, whether it's in organizations, whether it's in our congregations, in our communities, how can we make sure that we're not just addressing the health needs of a person in a silo, but how are we addressing the entirety of that person's life? Because as you rightly stated, if I have to work all day, right, I can't make it to the doctor's office. If I only make minimum wage, I can't afford the co-pays that I have to go to. I went to the doctor 3 times this week. Each day I had to pay a copay. I think about the person who's on limited income, who makes a decision and says, I'm going to go once. I don't know about the other times. Matter of fact, I might just go once this entire month, especially if you're being treated for something. What will be the health outcome of that person? And so in my role at University Hospital, we have a number of programs, and our goal is to make sure that we're working with every patient that needs additional assistance, the vulnerable patient population, to make sure that we are connecting them to the resources and services that they need. And so our hope is that you are charged in one way or another, and know that health is also a part of this conversation. And it's not just the clinical side, but it's also the social, because all of it goes hand in hand. Thank you so much for your time, and we bid you well.